Hello, I'm Dr. Grace Nambachachainei, an alumni of Loughborough University, UK, Executive Director, Natural Chemotherapeutics Research Institute, Ministry of Health. Very, very passionate about looking into ways through which we can manage lifestyle diseases. These are diseases that you do not get by sitting next to anybody, but they are really propagated by lifestyle. The likes of high blood pressure, you may call it hypertension, diabetes, mention it. Today we're going to talk about high blood pressure. Most people talk about high blood pressure as that situation where you really feel the heart is palpitating, you really hear the heart palpitating. God never meant us to know when the heart is beating. But the moment you start hearing it, then you know there is a problem. Pressure that is normal is measured in terms of what we call systolic and diastolic. Systolic is that measurement of the heart when it's normally active. But when the heart is at rest, then we talk of diastolic, and the normal one is usually 120/90, and the measurements are millimeters of mercury. When the readings are a bit higher, like if the upper one is 140 or above and the lower 180 or above, then that pressure is high. Remember, the pressure is born out of blood flowing and hitting the walls of the blood vessels, and if it's beyond normal, there is a risk of damaging the blood vessels, and of course the problems start from there. So generally in our healthcare, especially in Uganda, when we look at the Western health care base, you go to a healthcare provider and they would do the necessary diagnosis and put you on proper medication if it's necessary. Now, on our side of alternative or complementary healthcare, we respect what is done on the other side, but then we want to look at ways through which we can support ourselves so that we're not always on medication. We're going to look a lot into various ways of doing this. Simplest way is exercise, and the simplest exercise is brisk walking, weight management. Those are the very fast ways through which we can support ourselves to have healthy blood pressure. But we're going to look at what we eat in terms of fruits, vegetables. We can look at spices. We're going to really get into that area of assessing what people normally popularize: garlic, hibiscus, green tea. These are really useful, but it's very important to know how much should you take and in what combination. Currently, WHO is emphasizing strategizing on traditional, complementary, and integrative healthcare, where integrative healthcare takes care of the biomedicine or the usual conventional medicine that we see. Yes, we've been doing these things over time. You take this, you take that. But time has come for us to take care of how much the dosage is. And that's what we call scientific evidence. So, dear my followers interested in this kind of interface, I encourage you to subscribe, keep following, keep learning.